My name is Tessa Hartsell, and tonight I am going to be doing an assessment of the respiratory system, cardiovascular, and abdominal. And my subject is going to be Jeffrey Hartsell, and he is about to have a seat now. I'm going to start off by looking at the lungs and inspecting the anterior and posterior thorax. And what you're looking for is shape, color, movement. You want to make sure that anteriorly they are symmetrical and posteriorly they are symmetrical. When you are doing a respiratory assessment, you do not want to let your patient know that you are counting respirations, because this can affect their breathing pattern. So you want to do that without the patient knowing that you're actually checking their respirations. So with him, you're just looking at chest expansion as he breathes, making sure everything is symmetrical, both on the front and the back, which there are. You want to look at color, make sure that the color is a normal color, and just the movement and overall pattern of the breaths, and they all seem to be within normal limits. You want to look at thoracic expansion and just making sure that it's expanding, and that they're not sucking in or anything of that nature. You want to palpate the thorax, both posteriorly and anteriorly, and of course let the patient know if they experience any tenderness to let you know. And so you would just palpate. You're looking for masses, tumors, tenderness, anything of that nature, and you want to do it bilaterally and make sure that everything feels symmetrical when you palpate. You would also do this anteriorly as well. And everything is symmetrical. Like I say, of course, have the patient tell you if they experience any tenderness. Alright, next I'm going to palpate the the tactile femoris, and what you do is you sort of put your, scoot up just a little bit for me. You do this posteriorly and anteriorly, and just have the patient say 99. Can you say that like 2 times for me?
99, 99.
And you just sort of feel like a little vibration. All right, sit back and we're going to do this anteriorly as well, okay?
99, 99.
Perfect. All right. Next, I'm going to measure for diaphragmatic excursion, and I just want you to sort of sit up for me. And you want to do this bilaterally. And you do this by palpating. And you want to mark your area right here. Right there. And as you go down, you would hear dullness. When you palpate, you just want to make sure your one finger is touching the patient. And next you want to measure. This is typically 3 to 5 centimeters. And his is showing right at 4.5. Right, at 4.5 on that side as well. Next, I'm going to percuss all the lung fields bilaterally, and you sort of start up top. Like I say, once again, when you're percussing, you want to do it bilaterally. Alright, that pretty much completes my respiratory or lung assessment. I'm next going to move to cardiovascular and checking the cardiovascular system. With this, I'm going to be inspecting the anterior and posterior chest once again. I'm looking for any thrusts or heaves, anything of that nature. You want to palpate for any murmurs. We'll also be auscultating for these as well. I'm going to auscultate at this time. And just breathe normally. I'm going to palpate the temporal arteries here. Bilaterally. Carotid arteries. You want to do this one at a time. Radial. You can do it bilaterally. Brachial. You can relax your arms. All right. I'm going to palpate also the popliteal and posttibial and dorsal fetus pulses, but I'm going to first scan the room and I'm going to let him get lying down so we can get ready for the abdominal assessment here. Here's my, this is what my, everything is sitting on here. Trying to get a scan of the room. Here's going to be my patient. What I'm going to do is I'm going to move these books that everything was sitting on just to make it where I can see my patient on the ground at this time, on the couch at this time. So I'm going to just feel the pulses here, the popliteal. Dorsal fetus. And you just want to make sure that you feel them bilaterally and that they appear to be equal. Next, I'm going to be moving to the abdominal assessment, and when you're looking at the abdomen, you're looking once again at symmetry. You want to look at the belly button and or umbilicus and make sure there's no bulges or anything there. Of course, you can look for stretch marks or discoloration in the abdomen. And he doesn't appear to have any of that going on. When you are assessing the abdomen, you always want to listen before you palpate or percuss or anything of that nature. So I'm going to first listen, and when you're listening to the abdomen, you want to start in the right lower quadrant. pretty much just want to make sure that you hear vowel sounds in each of the 4 quadrants. You also need to listen to the aortic, and you want to listen to the iliac arteries. I'm going to do that now. The iliac arteries, listen there bilaterally. The renal. And then the femoral artery. Okay. Next, I'm going to percuss the abdomen, and you use the same method. Just make sure the one finger touches, and you just sort of move an upwards pattern. You will hear dullness over the liver and the spleen. And then I'm going to percuss the liver. Percuss the spleen. Now I'm going to palpate the liver, and what you want to do is stand on your patient's right side and sort of reach up under them. And the liver is located in the upper right quadrant. And just have the patient take a deep breath. Take a deep breath. And what you're trying to do is just getting the liver to move anteriorly where you can palpate it. And of course, you want your patient to let you know if they experience any tenderness. Any tenderness? No. Then you do the same thing for the spleen. Deep breath. Any tenderness?
No.
You just palpate the abdomen. Of course, always letting your patient know if they experience any tenderness to let you know. Alright, and then when you are trying to feel the kidneys, they're even harder to feel. You have to do like a deep palpation. Alright, just breathe deep for me. Next, I'm going to measure the liver and stand on the right side once again. Do this. Liver is normally 3 to 5. 5 to 10 centimeters. And you'll hear dullness as you get lower. All right, that completes my assessment of the lungs, cardiovascular, and abdominal assessment. Thank you. How do I turn this thing off? What do I hit, Jeffrey?